Hey guys, it's me. Yeah, over here. It's Dr. Wilson. Guess what? Time for another EMS video. Let's go back to my office to talk about some respiratory issues. I think we're going to talk about COPD, CHF, non-invasive positive pressure ventilation. I'll meet a couple of friends of mine. Let's go.
That's coffee! So, today we're going to talk about a few respiratory things that can actually cause some trouble for individuals. But we got a couple of things out there that can actually be useful to fix them. One of those things is CPAP. Out in the field right now, we use CPAP for probably one diagnosis that we're pretty confident in, which is actually congestive heart failure. But CPAP has other uses too for patients with COPD. And the good thing about CPAP is that we all know how it works, right? Right. Okay, I'll explain how it works. I ask the question all the time, how does CPAP get rid of the fluid in congestive heart failure? And the funny thing is, individuals still seem to believe that CPAP seems to push fluid out of the lungs. CPAP doesn't push fluid anywhere. Now, how does CPAP actually help to relieve the patient of their respiratory difficulty with pulmonary edema, cardiogenic pulmonary edema, that is? Well, CPAP actually helps to make the heart work more efficiently. If you think about this example, it'll help you understand how CPAP actually works, because CPAP actually helps to decrease the preload and afterload on the heart, and then the fluid will actually be reabsorbed through osmosis, which is how all fluid moves. So, if you had a basement that was flooded, and you had to get rid of all the fluid in the basement, you could do a couple of different things. First of all, you got to find out where the leak is. So say this wall over here has a leak coming in. Fluid's rolling into my basement. And I've got a pump that I've set up to try and pump the fluid out of my basement. And I've set up the pump, and I find out that the pump's not working efficiently enough to pump out the fluid faster than my basement floods. So I've got failure of my pump. Heart failure, pump failure. I could do a couple of things to try and fix that problem. I could either find that there's a obstruction in the outflow tract, relieve that outflow tract obstruction, and allow the pump to work more efficiently and try and pump faster than the water coming in. And that's kind of reducing the afterload by using things like nitroglycerin and other vasoactive agents. I could tinker with the pump itself by giving medications like digoxin or things like that. That's what we do in the hospital, and try and make the pump work more effectively. You guys don't do that in the field though. Or I could actually plug the hole where the water's coming in and slow down the preload coming back into my basement. When people think that CPAP works by pushing fluid out of, say, the lungs, it'd be like walking into your basement with a leaf blower and saying, hey, let me start with the leaf blower, and blowing fluid towards the wall, hoping that it goes through your wall, and now suddenly you are insane. Completely insane in the membrane. Insane in the brain! It's, oh jeez, oh, I got a lot of pain. Oh, God. I guess that fall really was kind of a problem. I think I got rhabdo. Oh, fluids in, fluids out. Ooh, garlic. This is Bane. Bane was an active guy. Super nanny in a desert pit to Ra's al Ghul's daughter Talia. International terrorist and frenemy to one billionaire Bruce Wayne. But now, Bane is not as active as he once was. Bane has COPD. Notice the constant CPAP on his face. Now, Bane needs to get his breathing right again so he can actually battle the bat and break his back. And how can he do that? By using Spiriva. Or eating Activia. One of the two. He got to be regular. That Bane's got to be regular. But I'll tell you about Bane and COPD. How is BANE with his COPD going to do well in the world? Well, I'll tell you. The use of CPAP with COPD has been well noted because COPD is a disease that actually involves chronic inflammation of the lungs. Now, that chronic inflammation of the lungs actually leads to breakdown of connective tissue, and stiffening of the lungs in some senses, and loss of elasticity. And this is why COPD is very different than asthma, because asthma, it actually has inflammation only involved in the airways. But COPD actually involves inflammation of the airways and the lungs. So the use of beta agonists is not as effective in controlling the disease process. But the use of CPAP, boy, that helps out tremendously because you've got this constant airway pressure causing those stiff lungs to be a little less stiff and be a little bit more compliant, and allows better oxygenation and ventilation taking place. So Bane, you keep on breathing, brother. You keep on breathing. BANE, COPD, it won't stop you, brother. It won't stop you. A full force. I got it up. I'm sorry.
Sorry.
Hold on. This is Darth, active father of twins, former second in command of a multi-galaxy spanning super corporation / empire, and once consultant to Martha Stewart. The Dark Lord of the Sith unfortunately suffers from another force, stronger than the dark side itself. It's called hypertension. How does Darth deal with the extra work on his heart to get his pump flowing like a full-on force choke? Why, he uses CPAP constantly. Look at that face. Look at what he does. Listen to the breathing. You all are quite familiar with the benefits of non-invasive positive pressure ventilation, CPAP and BiPAP by now. Decreasing preload, decreasing afterload. But one benefit that Darth Vader also has is the use of his diuretic agents on a regular basis. Prescribed medications definitely help keep the congestive heart failure patient out of the hospital. Now, one thing you may be noticing now is that in our SOPs, diuretic agents have gone down the drain. We've diuresed them from our system. And there's a reason why we've diuresed them from the system, because they're not effective in the pre-hospital setting. Now, that sounds oxymoronic. You've got a patient who takes them all the time. Why don't we just give them another dose of their medications? Well, here's what happens in the pre-hospital setting. Patients get recognized as having a respiratory problem, and you'll be hearing a lot of those respiratory problems while you're getting this getting this new CE today. Patients can also have pneumonia. They can have other causes of respiratory failure, which don't require the use of diuretic agents, and in fact may be harmful when they are used. If you look at some studies, diuretic agents are used almost 40% of the time to almost 60% of the time incorrectly for patients in the pre-hospital setting. So, if a medication is used almost 50% of the time incorrectly, why the heck would we give it? And we give some of these patients these medications and they get over-diuresed. They receive diuretic agent in the field, they've taken the diuretic at home, and we give them another agent when they arrive in the emergency department. And by that point, when they're already in renal failure to begin with, their kidneys just don't like it anymore. But Darth's doing okay. Keep using that CPAP, Darth. You're looking good, brother. Looking good.
I can't breathe in this thing!
There's asparagus. But anyway, hey, guys. A couple things. We've actually talked about COPD and understanding that the inflammatory process in the lungs is involving the airways and the lungs themselves. So really not that reversible with beta agonists. You know, CPAP Helps tremendously. Talked about CHF, and you guys know how to treat that quite well. You guys have been very proficient in the use of non-invasive positive pressure ventilation for the longest period of time, and we commend you on that as medical directors. But remember, there's also the downfall to using non-invasive positive pressure ventilation or any positive pressure ventilation for individuals. It does inhibit preload. If you inhibit enough preload, heart basically goes kaput on you, okay? So you got to use your tools to your advantage. You know, a hammer is a useful tool. I can build a house with it or steal a house with it. If I want to beat you in the head, boom, and take your home, I'm old boy style. I'm talking the old Korean version of the movie, not the new version. Check it out. Hey, Dr. Wilson here. Check you guys next time. Hopefully I won't be running next time. Some other activity. Jeez. These stones are ridiculous and tasty. Oh, gotta get hydrated too. Ah!